Hello, everyone. Welcome to today's webinar. For all my pre-nursing students out there, or maybe you just want a little bit of practice with some dosage calculation, real simple stuff. I'm here today to walk you through a webinar about some dosage. My name is Tiffany Palino. If I have not met you before, welcome. I've been a nurse over 16 years, an educator almost 6 years now. And I've done all sorts of nursing. And let me tell you, you use dosage all the time. I know it might feel like you don't, right? But it's safety, right? So remember, practice is key to success. Don't hesitate to ask questions as we go along. Let's make the most of this and let's do some questions together. We're going to go over some basic stuff because guess what? Even on your pre-nursing exams, your entrance exams, you still may have practice questions that are related in the math section to simple conversions or simple dosage calculations. So I'm going to go over some of those. But if you're a nursing student out there, or maybe you're about to take the NCLEX soon, this may help you out as well. So, conversions is the first thing we're going to talk about. Dosage conversions, there's a lot. And what I want you to do is understand them rather than just memorize. So, really, metric conversions are number one. We use this so much in nursing. 1 kilogram is 1,000 grams. Not listed here is 1 kilogram is approximately 2.2 pounds as well. Another conversion is 1 gram is about 1,000 milligrams. So then we have to know what a milligram is, right? About 1 milligram is about 1,000 micrograms. And then 1 liter equals 1,000 milliliters. So there's a trend here. If you didn't notice that on the left side here, I have a number one. And on the right side, it's 1,000. So if you can kind of remember this conversion, it'll help you in some of our problems. Really, the beauty of the metric system is everything's quite simple. Everything's based on multiples of 10. So in this case today, we're talking all about our 1,000. So 1,000 grams, 1,000 milligrams, 1,000 micrograms, 1,000 milliliters. So it's pretty straightforward once you do get the hang of it. As we move forward, think about how this applies to anything real world, like converting medication doses, which we're going to talk about, and then also our fluid volumes. So a liter, that is your bag of IV fluid, right? It comes in kind of a bag like this. You spike it down here, and here's your IV fluid. That is typically a liter bag, but it's also known as 1,000 milliliters of fluid. So keep this in mind. Remember, we have to understand some of these basic conversions in order to perform some of our dosage calculation questions, and also understanding whether we should be multiplying or dividing in order to get our answer. Okay, so let's move right along. Couple more hints here. So if you're going from bigger to smaller, you're making more pieces, so you want to multiply. I hope that makes sense. So bigger to smaller, think about we're breaking things up into a lot of pieces, so that really means we have to multiply it. So this is something like going from kilograms to grams. Now, opposite of that, if you're going from a smaller unit and you need to make a bigger unit, you're grouping things together, so you have to divide. Think of this as converting milligrams to grams. Remember, in metrics, the magic number is 1,000, okay? Especially in dosage calculations. So really, this is fundamental because we're practicing safe and effective patient care. We don't want an extra zero on there, right? Because that it could be life or death. So that's why we take dosage very, very seriously. Hope you're all with me now. So we're going to get into a couple more conversions. So 1 kilogram is 2.2 pounds. I did mention this earlier. This is super important because in healthcare, we typically measure in kilograms. We do measure in grams when we're talking about our smaller patients, like our babies, newborns, that sort of thing. But I want you to remember this simple rule. We did mention it in a previous slide. If you're going to bigger to smaller, you're multiplying, right? If you're going to smaller to bigger, you're dividing. And 1,000 is kind of that magic number. This is what I mean when I'm going from kilograms to grams, grams to milligrams, milligrams to micrograms. Everything on this side is smaller. So we'd have to multiply. Everything here, if we're going to go in the opposite direction, everything here on this side, milligrams, grams, and liters is bigger. So you want to multiply when you're going smaller, divide when you're going bigger. Hope that makes sense. Okay. In this section here, we have those household conversions. So go over onto your kit in your kitchen, see if you have some of these things and kind of understand what they mean in relation to healthcare. So when would I even worry about teaspoons or tablespoons? Well, a lot of times, over-the-counter medications are prescribed this way, and it's important to remember what the conversion is into milliliters. Milliliters is typical of what we use in the hospital setting or in the healthcare setting. And so, rule of thumb, 1 teaspoon is 5 milliliters, and then a tablespoon is 3 times that. So that would be 15 milliliters. Now, do you remember those little med cups from the hospital? Those little cups are just 1 ounce, and 1 ounce is 30 milliliters. You can also think of it as 2 tablespoons because 2 tablespoons is also equal to 1 ounce. Another important one to remember is how many ounces are in a cup, because when your patient is eating or drinking, it's important to keep track of those intake and output. So 1 cup of something is 8 ounces. 1 pint of something is equal to 2 cups. You also could say that this is also equal to 16 ounces because 2 cups, you do 8 times 2. A quart is 2 pints and a gallon is 4 quarts. The ones I really like to focus on are kind of these first four when it comes to our clients that are in the hospital setting. We're keeping track of our intake and output. We are going to get into some time conversions at the end of today's session. So it's important to remember 60, okay? 1 minute is 60 seconds. 1 hour is 60 minutes. And then how many hours are in a day? That's the other thing we need to remember, which is 24 hours in an entire day. So keep in mind that all of these on this page will be very useful in calculating some things that we're going to talk about on the next slide. But also, it is important to memorize, but I want you to understand. 1 teaspoon, 5 milliliters, 1 tablespoon, 3 times that, so 15 milliliters. An ounce, 30 milliliters, a cup, 8 ounces. And it could take you further, right? It could say a cup, convert to ounces and then to milliliters. So we know by using our conversions up here that we could do that. Okay, let's keep going and let's put this to motion. I would like to dive into these conversions. These are really, really crucial. So let's take a dive into this first one together. 36 pounds is equal to how many kilograms? Now, if you remember from the previous page, 1 kilogram is 2.2 pounds. So how am I going to do this? You're going to multiply or divide. Well, we are going to have to divide because we have pounds already. So we're going to divide 36 by 2.2, divided by 2.2. And our answer is 16. And we'll say we'll round to the nearest tenth, and that would be 16.2 kilograms. Okay, so that was our kilograms one. How about number two here, which is about ounces? This one might be a little tougher because we're going from gallons to ounces. So how many ounces is 1.5 gallons? Now remember, 1.5 gallons is bigger, right? So if we're going from bigger to smaller, we have to multiply. So do we remember how many ounces are in a gallon? Let's go back. So how many ounces? So 1 cup is 8 ounces. 1 pint is 2 cups, which would be 16 ounces. 1 quart is 2 pints, so that would be 32 ounces. So um, knowing that, I would be able to convert. Oh, sorry, I was at quart. I meant to go to gallon. And then knowing that, so 1 gallon is 4 quarts. If this is how many is in 1 quart, I would multiply this times 4, and I get 128 ounces. Okay, so I know 1 gallon is equal to 128 ounces, but I have 1.5 gallons. So how many ounces are in 1 gallon? There's 128. I'm going to need to multiply 1.5 times 128 to get my answer, which is 192 ounces. Hopefully you understand that. And then this is for that first one. So we didn't talk about number 3, which is millimeters to centimeters. We don't use this too much in healthcare, sometimes depending when we're measuring someone's wound. However, it's important to know. So there are 10 millimeters in every centimeter. So if I'm going from bigger to smaller, remember I have to multiply. So if I know there's 10 millimeters for every centimeter, I would just multiply 10 times 18, and then I would get 180. That would be my answer for number 3. Finally, our conversion from tablespoons to teaspoons. This last one here. So, how many teaspoons are in 1 tablespoon? We talked about this on the previous slide. There are three teaspoons for every tablespoon. So if we have 4 tablespoons, we multiply 4 times 3, and then we would get 12. So these were some basic conversions. They're foundational, but it is important. It's important to understand how to do these kind of simple conversions now, because you could get a more complex problem later on. Okay. Let's move on, everyone. Hopefully, you're still with me. Let's talk about dosage calculations as far as it goes with fluid rates or flow rates. So, what we're talking about here is IV fluid, right? So, milliliters per hour, that's basically how much fluid a client receives through an IV, and most pumps are set to milliliters per hour unless it specifies something else and it tells you to do it differently. So if you have a total amount of fluid, I'm giving an example here. Let's say we have a 500 milliliter bag and they want you to give it over 4 hours. All you do is divide it. You divide the total volume by the amount of time. And as long as my answer is in milliliters per hour. So this is essentially what I would set my pump to, 125. So think about how medications need to be given at precise rates, and controlling this milliliter per hour helps make sure they're receiving the correct amount and the correct amount of time. It's not just about fluids, but it's also about medication. So there's certain medications that we'd want to run at a certain rate. And then think about just regular IV fluid, like normal saline, also known as sodium chloride. You want to run it at whatever the doctor told you to, right? So maybe the order is like this. Here's a bag, give it over 4 hours. So it's up to you as the nurse to determine how to set the pump. Let's try another one. A client is prescribed 600 milliliters of saline solution to be administered over 5 hours. Calculate the flow rate in milliliters per hour for the solution. So we need milliliters per hour. This is how I always start my problem. What do I need? I need milliliters per hour. What do I have? I have 600 milliliters, and I know I need it in 5 hours. So do I have my answer? Yes, you're just going to divide 600 divided by 5. So my rate would be 120 milliliters per hour. That makes sense, right? So this is where I want to kind of teach you to double check your answer. You want to make sure whatever you come up with your final answer, you kind of do your math backwards to make sure it makes sense. So I would say, okay, let's see, 120 milliliters per hour. The first hour they get 120, the next hour they get 120, the third hour they get 120. Okay, we're a little over half. That makes sense to me. And I have 2 hours left, and there's 240 left. Perfect. So kind of just think about if this number makes sense to you. If you got a really small number or a really high number, before you click submit, make sure it makes sense. Okay, let's try one more like this. The client needs to receive 40 milliliters of solution over 15 minutes. What are you going to set the pump to in milliliters per hour? Now, this one's a little bit different, right? Because I don't have milliliters per hour in my problem. I have milliliters and then I have minutes. So you have to do a little bit of a conversion here. There's a few ways you can do this. You can think about how many 15s are there in an hour? Well, how many times do we need to go in a 60-minute period is 15 minutes. So it's 15 minutes, 30 minutes, 45 minutes, and then an hour. So that's 4 times. So a simple way to do this is multiply 40 times 4. And that's going to give me how many milliliters per hour I need to give. So if I multiply 4 times 40, because there's 15 minutes in 1 hour, that'll give me 160 milliliters per hour. I also like to think of it kind of like a clock or a coin. So if this whole thing is 1 hour, I have 15 minutes here, 15 minutes here, 15 minutes here, and 15 minutes here. There's four of them, right? That equals a whole hour. Could also say that this is 30, you're at the 45 mark, and then you're at the 1 hour. So understanding that we have all four there. Super important to understand what to run it at, especially when you get these kind of orders when they want it to run much faster. That's what I also want you to think about. 160 milliliters is pretty fast, right? But I only have 40 milliliters to give. So that makes sense to me that we're going to run this really fast because it's only giving over 15 minutes. I know that one was a little tough. Okay, we're going to close out with some military time. This is one of those first concepts you got to learn when you're in nursing school, so it's a great thing to discuss now. Here's a table. Love this table. It is showing you what 12 a.m. is, what 12 p.m. is, but it's super, super straightforward. So let me give an example here. Let's all look at 11, this last one. So 11 a.m., it's just going to be 1100. So if you notice here, we don't use colons in military time, okay? This row is military time and this row is military time. We don't use colons, okay? But look, 11 a.m. goes right to 1100. Makes sense to me. But with 11 p.m., the key is you add 12 or 1200 essentially in this case to 1100, and that's how you get your 2300. So really, if you look at all of them, right? 9, add 1200 to it, 2100. 6 a.m., 0600, you add 12 to it, 1200 to it, and you get 1800. So that's what I want you to remember. One big thing to note, this is how it's a little different than military time, because if you are in the military, you know about military time. The military calls this 2400. In medicine, we call it 0 hundred hours, okay? Because if it's 12:05, let's say, 12:05 a.m., then that would convert to 0005. So we do not use 2400 in our medical military time. Okay, let's practice some of these. I have 3 practice questions for us. So we need to convert 9:45 p.m. to military time. So remember what I just said? All you do is add 12. So, or 1200, I should say. So you're going to add 12 to the 9, and that 12 plus 9 is 21. And then you're going to keep the 45 because there's nothing to add there. So 2145 would be the answer to number one. Number two, you're going to convert 0720 to an AM or PM time, meaning we're going to do it backwards, okay? So we have the military time. So now tell me what the clock time would be. So 07 220, sorry, 720. So converting this, it would be 720. Is this AM or PM? This would be AM. AM. Very good. Now, finally, this one's a little different here. I want you to convert 6.25 hours to hours and minutes. Because can we have a quarter of an hour? Sure. But what is that in minutes? So I want you to remember that kind of that thing I drew in the previous slide. When we're talking about our hour, I think of a coin or a circle of some sort. So 0.25 is also equal to 15 minutes, right? 0.50 of an hour is also equal to 30 minutes. 0.75 of an hour or 3/4 of an hour is equal to 45 minutes. And then 1 hour is 1.0. Um, it's 60 minutes. Sorry, that's what I meant to say. 60 minutes. So I like to use this as a reference when I'm doing a problem like this because 0.25 is just this amount, right? It's a quarter of an hour. Well, we talked about that there's 0.25 is also equal to 15 minutes if we're dividing our clock. Another way you can do this, 0.25, you're going to multiply that times 60. And what do we get? 15 minutes. So 0.25, 1/4 times 60 is 15. And that's in minutes because this is minutes here. So if I have 6.25 hours and minutes, it's 6 hours, 15 minutes. This goes for anything, right? Let's say this was 6.33 hours. All you do is multiply whatever's in the after the decimal times 60, and that'll get you the amount of minutes. Okay, I got a bonus for you all. An IV started at 2140. Now, what is 2140? What time is that? What time is 2140? Remember, how do I get the other way, right? So you could subtract 1200 from this, and it would tell you. So 2100 is 9 p.m. So this is 9:40 p.m., just so you know. Okay, so it started at 9:40 p.m. or 2140, and it's expected to finish in 6.75 hours. When is it gonna finish? So, a couple ways we could do this. Basically, what you need to do to finish or find out the finish time is we need to convert. We need to convert this 0.75 hours into minutes. How do we do that? I just talked about it in the previous one. 0.75 times 60 minutes, and that'll give me 45 minutes. You can also go back to here where I kind of did that little diagram here. Remember, 0.75 is equal to 50 minutes or 45 minutes. Okay, so we know we need 6 hours and 45 minutes from this time. So all you do is add 9:40 plus 6 hours and 45 minutes. What is that? What is 6 hours and 45 minutes later? So if it's 9, so the easiest thing to do, honestly, is to write this all out or count on your fingers, however you want to do it. So for purposes of today, because I'm not going to write all this out, is I'm going to go from 6 hours from 9:40. So 10:40 p.m., 11:40 p.m., also known as 22:40, 23:40, 0, Then on the fourth hour, it's going to be 1:40 a.m., 2:40 a.m., 3:40 a.m. Now I need to add 45 minutes to that. What's 45 minutes plus 3:40? It's going to be 4:25 a.m. That is what time this should finish because we're thinking about 6 hours and 45 minutes later from this time from 21:40. That was a toughie, I know. Feel free to practice military time by changing the clock settings on your phone to help you remember time. That's how I learned. Well, actually, I grew up in a time where we didn't have cell phones like we do now, but I always encourage my students to do that. I do that. It's perfect. Okay, I know that was a lot, but here's some key takeaways I want you to remember about dosage. Accuracy is key, okay, guys? A simple extra zero, decimal point moved, or misunderstanding of calculation is really critical for patient safety. Understand those conversions, don't just memorize them. I want you to take your time, okay? Set the problem up carefully and make sure it makes sense. Double check your work and work the problem backwards, like I said. So, it's important to understand this basic concept now because as you enter nursing school, that first semester, you're going to be doing some math and you want to understand the why behind it. So, if you use these strategies, you'll be well equipped to handle time conversions and regular metric conversions and dosage conversions. All right, anyone have any questions for me? If you scan here, we can get some pre-nursing products. So if you're taking your T's or HESI soon, best of luck. Use these strategies for your math section. If you're in nursing school, you can use these strategies as well. All right, if there's no questions and no one needs anything, it was so great being here with you all today. Best of luck to you as you start the semester strong. And if you need us, you can always email us at nursing@archerpulse.com. And again, my name is Tiffany Palino, and I hope you all have a great day and best of luck with all your tests. Take care, everyone.